Is your newborn's umbilical cord looking a little weird? Diaper rash spreading no matter what you try? Or maybe your baby is crying inconsolably at 2 a.m. and you have no idea what's wrong. If you're a new parent feeling overwhelmed by these everyday baby care challenges, you're in exactly the right place. Hey there and welcome. Before we dive in, make sure to hit that subscribe button and turn on notifications so you never miss our practical parenting tips. Trust me, you'll want these in your back pocket. Today, we're covering the most common baby care concerns that every new parent faces in those first few weeks and months. From umbilical cord care to handling colic, we're breaking down exactly what to do, when to worry, and when to call the doctor. Think of this as your quick reference guide for keeping your little one healthy and comfortable. So, let's get started. First up, let's talk about that umbilical cord stump. I know it can look a little strange, but caring for it is actually super simple. The cord stump will naturally fall off within 2 to 3 weeks after birth. Your job? Keep it clean and dry. Here's exactly how. Keep the diaper folded below the cord. You want air circulating around it, not moisture from a wet diaper. Many newborn diapers actually have a little notch cut out specifically for this reason. Clean it once or twice a day with rubbing alcohol on a cotton swab. Just dab it around gently around the base. Some healthcare providers now say you can skip the alcohol and just keep it dry. So follow your pediatrician's specific advice. Now, when should you be concerned? Call your baby's doctor immediately if you notice redness spreading around the cord area, if it's oozing yellow or green discharge, if there's bleeding beyond a tiny spot, or if it smells bad. These could be signs of infection, and while rare, they need prompt attention. One more thing, you might see a tiny bit of blood when the cord falls off. That's totally normal, just like when you lose a scab. All right, next up, the dreaded diaper rash. Almost every baby will get this at some point, so don't feel like you're doing something wrong. Prevention is your best friend here. Change diapers frequently, ideally as soon as they're wet or soiled. Babies have incredibly sensitive skin, and sitting in moisture is the #1 cause of diaper rash. At each change, wash your baby's bottom with warm water and mild soap. Pat dry completely before putting on a new diaper. And here's a pro tip. Let your baby have some diaper-free time each day. Even just 10 to 15 minutes can make a huge difference. If rash does appear, don't panic. Use a thick barrier cream with zinc oxide. Think of brands like Destin or Boudreaux's butt paste. Apply a generous layer after cleaning and drying the area completely. For stubborn rashes, increase that diaper free time. Lay your baby on some cloth diapers or waterproof pads and let their skin breathe for a few hours. Fresh air is amazing for healing. If the rash is bright red, has open sores, or doesn't improve after 3 days of home treatment, call your pediatrician. It might be a yeast infection that needs prescription treatment. Now let's talk about 3 common situations: diarrhea, colic, and colds. Diarrhea in babies needs close attention because little ones can dehydrate quickly. If your baby has very watery, explosive stools more than 3 or 4 times in a day, call your doctor. This is especially important for babies under 3 months. One large watery bowel movement in a tiny baby warrants a call. If you're breastfeeding, continue nursing. Your breast milk actually contains antibodies that help fight whatever's causing the diarrhea. Your pediatrician might recommend an oral electrolyte solution like Pedialyte to prevent dehydration. Now, colic is that heartbreaking, inconsolable crying that some babies experience, usually in the evening. First, rule out the obvious. Is the diaper wet? Is baby hungry? Is clothing too tight? Try the colic hold. Lay your baby tummy down across your forearm with their head near your elbow and gently rock or walk around. The pressure on their tummy plus the motion often helps. White noise, like a vacuum cleaner or hairdryer, can also work wonders. For colds, remember that babies can't blow their noses. Use a bulb suction or nasal aspirator to gently clear their nostrils. Keep the air moist with a cool mist humidifier. And here's something crucial. Any fever over 100 degrees Fahrenheit in a baby requires an immediate call to the doctor. Speaking of calling the doctor, let's be crystal clear about when you need to pick up that phone immediately. Call right away if your baby has difficulty breathing, or seems to be working hard to get air in and out, you might notice their chest pulling in with each breath. Is crying more than usual or in a different way, like moaning or high-pitched screaming as if in pain? Has a temperature higher than 100 degrees Fahrenheit? In newborns, fever is always serious. Vomits forcefully, not just normal spit up, or passes blood in their stool or urine. Has a convulsion or seizure with shaking arms and legs. Also call if your baby seems unusually weak, not crying with their normal strength, or is too sleepy to wake for feedings. For bottle-fed babies, that means less than half their normal amount. Just doesn't seem right to you. Trust your parental instincts. You know your baby better than anyone. Here's a tip. Keep a list by your phone with your pediatrician's number, the after-hours nurse line, and your local pharmacy. When you're worried about your baby, the last thing you want to do is search for phone numbers. All right, let's wrap this up. We've covered a lot today. Keeping that umbilical cord clean and dry, preventing and treating diaper rash, recognizing diarrhea, colic, and colds, and knowing exactly when to call your doctor. Remember, you're not expected to know everything right away. Parenting is a learning curve, and every baby is different. When in doubt, make the call. Pediatricians would much rather you check in with a question than worry in silence. Before you go, please hit that subscribe button if you found this helpful. We're here to support you through every stage of your parenting journey with practical, real-world advice you can actually use. Drop a comment below and tell us, what baby care topic do you want us to cover next? And if you found this video valuable, share it with another parent who might need it. Thanks so much for watching, and remember, you're doing an amazing job. We'll see you in the next video.